talk about the modalities of teledentistry. So there's the synchronous, it's face-to-face, which I think you probably all are seeing behavioral health and primary care in your health centers. We can also do that in dentistry. And then asynchronous, and what we saw in our learning community this summer was that in places where the payment environment wasn't set up to pay for synchronous, they did an asynchronous model where the hygienist had the face-to-face appointment, and then the dentist did the review. And the places where we saw that was actually some pretty cool applications. One was in a substance use disorder treatment center. So it's patients who were actually on a recovery path. They actually got a dental appointment as part of their recovery. And then if they needed care, they got right in for dental services. And then there's other strategies that we're not really testing in health centers, partly because of funding and technology, but there's remote patient monitoring, and then there's mobile health. And we're seeing a lot in the field that those will be the way of the future. And then on the next slide, if you really think about, and Dr. Hilton talked about this, these applications of teledentistry and what can we do in health centers, prevention and disease management, like those should just not be done in surgical chairs anymore. This 100-year-old system grew up to do it that way, but because of the innovation that's happened in our field, we really don't have to do that anymore. And so really moving that prevention to places in a less expensive environment. And so what the health centers and the learning community did is they would do as much of the preventive appointment via tele. And then if they needed something still like sealants or unfortunately fluoride, if you couldn't, in California, actually you can administer the fluoride at home, but in most other states you can't, then they would just pop in for, what we would consider a nurse visit in medical and could do the sealants, quickly get the fluoride treatment. But then, and then for more of a high-risk patients like the OB patients that we were seeing, or patients with diabetes, you could do all the talking part of the appointment via tele. The patient's actually more likely to attend the appointment, and then their in-person appointments were actually cut in half, the amount of time that clinic. So if you think about this from an operations perspective, there's a lot of efficiencies we could create by using tele. And so on the next slide, really what I want us to all think about is, what care needs to be delivered in person and what care could we do in a tele environment? And so risk assessment, exams and video that the families send in actually are, we're getting pretty good diagnostic quality, and I've got some photos I can show you of that. And then like motivational intervention, self-management, goal setting, a lot of high-performing health center dental programs. And if you could do that in an environment where the person is much more comfortable, where there's not the distractions and sounds and smells of the dental clinic, the self-management components work a lot better. And then coaching toothbrushing, what's been so cool is to see for the parents of 0 to 5-year-olds, when they demonstrate toothbrushing to the dentist on these televisits, what the care teams are reporting is that the families are more engaged in the home care, and they're seeing overall better home care because the parents have now demonstrated their competency versus being a passive observer in a typical dental appointment where you watch the dental hygienist do things to your kid. And then pre-planning, if you're experiencing symptoms, like sometimes if someone's got symptoms, they may have to take some medication ahead of time. So if you come in and you're swollen, they can't treat you, but they give you a prescription and then you got to come back. If you can do that at home, again, we've saved you a trip, saved you some time, saved the clinic an appointment. And then pain management strategy, and then supervising things like patient-administered care. And so I'm going to just quickly run through a couple of photos that I think hopefully will start to connect our brains with why we think teledentistry is an important part of the future. So this is an example of an at-home preventive visit. So this clinic sends, this is from Petaluma Health Center, and they send a care visit, a pre-visit package that includes the toothbrush, the mirror, and then the fluoride varnish, and then also some patient education, some patient education. And so the parent gets this, and then they attend their teledentistry appointment. So what you can see on this screen is the parent is on the left, and then this is actually the dental assistant on the right. And then on the next slide are some examples. It's not a dental presentation if I don't show you pictures of teeth, But if you look, and these are pictures taken with a cell phone of the, and so the dentist, one of the dentists said to me, I think I can do a better diagnosis with the pictures that I get on a cell phone than if I saw them in person. And so we can get pretty good images. And then if they can't see it clear enough, they have that face-to-face where they can also assess the symptoms and get in a closer view. And then, example of a parent demonstrating toothbrushing. And then this third one is in California, because of their policy environment, the parents can paint fluoride varnish on the kids' teeth. And then the next slide is just some more, I'm not a dentist, but you can get a really good look at what's going on in the mouth. And these are sent from the families. And then on the next slide, this is from one health center who collects patient satisfaction information, but the parents are very, very happy with it. I think one of my favorite quotes on this slide is, for a 4-year-old, this was the best way to deliver dental care. They put my toddler at ease. I really felt like they were supporting me and our family. Like this is the best dentist experience I've ever had with my daughter. I also learned new tips on how to brush and floss her teeth. And this was much more fun than the regular dental visit for a 4-year-old. So families are pretty happy with it.